Friends, comrades, brothers and sisters, can I thank you for that tremendous welcome? And don't worry, in a few moments or so, you will get the chance to hear from the leader of the Labour Party and the next Labour Prime Minister of this country. But we've just got one or two other things to do first, if that's okay with you. So can we start by thanking the choir? That was absolutely wonderful, wasn't it? And perhaps we should thank the impromptu choir as well. That was also entertaining. In a few moments, we've got some NHS workers who are going to speak to you. But first, we're going to share with you a video which you've probably all seen anyway and hopefully shared it on social media. But, oh no, you don't need to boo it, it's a good thing. Can we show you again our recent party political broadcast about the NHS?
It's just those times when you've been at work and you literally haven't stopped, and then you come back the next night and you find out that someone you'd spent all your time with has died. And it's even worse when you think that perhaps things could have been different if only, you know, you hadn't been doing the job of two people.
We're now coming to yet another winter where all elective operations have been cut this year. Patients have been waiting and waiting, and now they've been told they've got to wait even longer.
I've had people die waiting for an ambulance where I felt that if we'd have got them to hospital, they would have survived.
When I started training to be a nurse, we used to receive a bursary, which didn't really pay us that much, but it basically worked out to us getting around £3 an hour. Now that's been scrapped.
People born a few months after me will have over 40 grand of debt to sort out, as well as having, you know, not a particularly sparkly salary.
I started nursing at the first hospital opened for the NHS in 1948. Before the health service, there'd been a lot of fear about being ill. Even as a little girl, I recall going to the doctor with my earache and my parents having to pay, and the chink as the Cohens went into his pocket. And I realised my parents would have to go without something in order to get me the care.
We're in the process of privatisation, and a key strategy would be to make the NHS fail, look like it's failing, destroy the trust the public have in it, and destroy the trust that the professionals have in it. And then we'll be persuaded to call for something radical, and I think that radical will be conversion to an American-style insurance system.
It's not a business. We built it up with our tax so that our children and our grandchildren would have free healthcare.
Either you pay your rent, or your council tax, or you buy food. I've got colleagues that I work with that's got children as well. And to be honest, it's shameful when they said to me sometimes they have to go to the food bank.
So after, goodness, 20 odd years in the NHS, I resigned. And that for me was like leaving a family behind to leave the NHS.
And all of it, all of the working conditions together, and getting more and more feeling like, is this really worth it? Is this really worth it? Because this is what I love. But it's not anymore. And that's really hard to say. And I don't want to leave.
In the hands of hope, have we lost our soul? Oh, but she can't let go, 'cause she loves it so.
And interested in what Jeremy Corbyn has to say, simply because he genuinely wants to help me do my job.
The press and the Tories said that these were radical policies in a country as rich as Britain, where people are having to take second jobs, working people are having to go on benefits and rely on food banks. It's not radical to invest in the health service. It's not radical to take away privatisation from the health service. It's not radical to invest in us.
And now I'm back in the NHS and I want a Labour government. I want a better NHS for my children's future, and that is what will drive me forward and continue my fight.
You don't need to worry if you get a devastating illness and you have no one to look after you, because the NHS will always be there. If that resonates strongly with you as it does with me, then you've got to get out there and fight for it, and the first thing to do is to vote for Labour, because they're the only party who are offering us at the moment a real tangible means by which we can safeguard this most precious thing.
'Cause she loves it so.
Friends, I hope you'll all agree that that was an absolutely inspirational video. And I hope you'll also join with me in thanking not just those NHS staff who featured in that video, but thanking all our NHS staff for the work that they do day in, day out to care for our sick and our elderly and those in need. So from this hall, let us send a message to everyone across the NHS, the cleaners, the caterers, the chefs. We say thank you. To the dentists, the nurses, the paramedics, the health visitors, we say thank you. To the surgeons, the general practitioners, the receptionists, we say thank you. To the psychiatrists, the scientists, the ambulatory support, the junior doctors, we say thank you. Every single one of you. You care for us, and also to those of you who have come to our country from other shores as well. We say thank you too, and we will defend your rights, we'll defend your citizenship, and we'll send a message to you and your family. You're welcome here as well. But thanking our staff is more than about just words at conferences. Because our staff who work in the NHS are being asked to do more and more on less and less. Every day they're being pushed to the limit. Because we have 100,000 vacancies. We have rota gaps across the NHS. We have a situation where we've got vacancies for 40,000 nurses. Where we've got vacancies for midwives. We've actually seen the number of nurses beginning to drop. Nurses literally forced out of the profession they love. So we offer our staff more than just words. A Labour government, led by Jeremy Corbyn, will get rid of the pay cap and give our staff the fair pay rise they deserve. And because it isn't just about pay, but we know that is important when you've got nurses on the way home from a shift literally stopping off at a food bank to pick up a parcel to feed their children. We also know it's about recruiting and training the staff for the future, which is why we'll also bring back the training bursary as well. So we're training the nurses and the allied health professionals for the future. And this winter, yet again, we've seen the staff go well beyond the call of duty, caring for our sick. But we've seen yet again a winter crisis in the NHS, a winter crisis which was predictable and preventable. All the figures have shown we've now got something like over 100,000 people have waited in the back of an ambulance, often elderly people, in the freezing cold, waiting in the back of an ambulance because they can't even get into the overcrowded hospital. People waiting on trolleys, often elderly people, often confused, often with dementia, waiting on a trolley for hours and hours and hours in a corridor. And why? It's because for years and years the NHS hasn't been given the money it needs. And Theresa May just says, well, nothing's perfect, as if that's an adequate response. As if nothing's perfect is an adequate response for cancelling elective operations. As if saying nothing's perfect is an adequate response to the cancer patient in the city I represent of Leicester, who had his bladder cancer operation cancelled not once but twice this winter. As if saying nothing's perfect is an adequate response to those cancer patients in Oxford whose hospital was looking at delaying chemotherapy starts by 4 weeks, blaming a lack of capacity until there was an outcry in the national media. And we see that our staff are trying to work so hard, but this is against the backdrop not just of a winter crisis, but of all year-round crisis. Because we know that the waiting lists are getting higher and higher, and we're at around 4 million now. We know that trolley waits in the last year have not been 60,000 like they used to be when this government came in 2010. The numbers of people waiting on a trolley in a corridor over the last year, not 60,000, but 560,000. This is the scale of the difference in our NHS. And it's because we have had 8 years of underfunding of the NHS. 8 years of cuts to community and public health services. 8 years of savage cuts to social care provision. So lots of elderly and vulnerable people don't get the support in the community they used to get. 8 years of cuts to various different mental health services as well. 8 years of cuts and underfunding, which is causing the crisis in our NHS. Now, last year, they said it was a humanitarian crisis in our NHS. Well, our challenge today is when we leave this hall is to scatter across our communities and tell people it's way beyond a humanitarian crisis. And let's call it what it is, a Tory manufactured crisis in our NHS. And let's also tell people, as we're campaigning, that with Labour and Jeremy Corbyn, 8 years of austerity and our NHS will come to an end. If we were in government now, an extra £5 billion for our National Health Service. And how would we pay for it? Yes, we would put up tax for the very richest in society to fund a National Health Service there when you need it for everyone. Across a parliament, an extra £45 billion for our NHS and our social care system as well. That's the difference a Labour government would make. But we've also got to do something else as well. We've got crumbling hospitals in the NHS. We've got examples of hospital pipes, sewage pipes breaking in wards. We've got resuscitation areas having power cuts because we've not put the investment in to the NHS. So as well as an extra £5 billion investment for the running of the NHS, we've put an extra £10 billion into the capital funding for the NHS to rebuild hospitals and to give and to buy the very best equipment to treat patients in hospitals too. But there's something else we've got to do as well as putting the funding in. We've got to stem the flow of money leaving a public health service, flowing to private health providers. Yes, we've said we're going to look again at those PFI contracts, and we'll take no lessons from the Tories. It was the Tories who started PFI, and David Davis, Liam Fox, David Lidington, all these cabinet ministers were calling for PFI for a generation. So we'll take no lessons from the Tories on PFI. So we'll deal with PFI. But we'll also deal with something else. John Trickett, our Shadow Cabinet Office Minister this week, has said we will have a presumption that outsourcing ends and contracts come back in-house. Because we know that when you send a contract out of house, when you privatise it, when you outsource it, the way those firms make money is by cutting corners and pressing down and cutting the terms and conditions of the staff. It's why, for example, at a hospital in Nottingham, Carillion, they're getting a lot of news coverage at the moment, a contract with Carillion had to end because infectious waste was flowing through a children's ward. It's why a contract with Interserve at a hospital in Leicester had to end, because blood wasn't being cleaned off the walls of the wards and bins were being left unemptied. This is what happens with all this outsourcing and privatisation. We're going to bring it to an end and inject a presumption that everything comes back in-house. But we've got to do something else as well, because it's not just the outsourcing and the PFIs that we all know about. We know at a local level, because of the Lansley Health and Social Care Act, more and more contracts are going out to private providers, often for community health services, often for children's mental health services. It means that in an area, health visitors end up being down-banded or even being made redundant. It means there's been cuts. We know the service is inadequate. We know that Virgin Care has just won a contract up in Lancashire for children's health. And we know that when Virgin Care don't get their way, they sue the NHS. They take the NHS to court. And that's money that should be going to the public sector, not to the private sector, not Virgin Care. So let me tell you what else we're going to do to end this toxic privatisation agenda. The Andrew Lansley Act, the Health and Social Care Act, we are going to get rid of it, we're going to reverse it. And I can tell you today, we will legislate to reinstate, reintegrate and restore a universal public national health service, publicly provided, publicly administered, there when you need it, for everyone in the country. You know, this year is the 70th anniversary of the National Health Service. Created by a Labour government, voted against 20-odd times by the Tories. They fought it tooth and nail. And this year, we have to launch a big campaign to fight for the NHS and to save the NHS. So we're going to be campaigning on the investment, on getting rid of the privatisation, on giving the staff the support they deserve and need with a fair pay rise. But there's something else I want to talk about briefly. Because when Bevan created the NHS, and when he said it would lift the shadow from millions of homes, and when he talked about the creation of a more civilised society, he was talking about something much bigger, which I think we should remember today. Because the creation of the NHS, it wasn't just about the relief of pain and suffering. And it wasn't just about relieving the anxiety of the mother, like the story we've heard, the anxiety of that mother who had to pay for a family doctor to come to the bedside of her child. And nor was it just about defeating those big diseases that stalked the land 70 years ago, like polio and TB. It was about something even more fundamental than that. It was about creating a more equal society. And yet, a more equal society with an institution which covered everybody, which everyone paid into from general taxation. It's why we rejected social insurance schemes and means-tested schemes. This was about covering everybody, because it was about equality. And yet, 70 years later, today in Tory Britain, those health inequalities are getting wider than they ever were. Since 2010, the number of people, or the number of beds taken up in hospitals for malnutrition has doubled. Malnutrition has doubled. Today we've had news about the numbers of rough sleepers going through the roof, and that will lead to lots of inevitable health issues. We've got a new phenomenon in society now. Some of you may have heard of it. It's called DIY dentistry, where people go to some of these pound shops you see on the high street to buy a DIY dentistry kit, where they can do their own fillings, where they have their own scrapers and mirrors, because of the poverty and they can't get an NHS dentist. And a child born tonight, while we're having this meeting, in some of the poorest parts of the country, like the constituencies that I and Jeremy represent, a child born in that constituency will live, on average, 9 years less than a child born down the road in Chelsea. And that child born in the constituencies like we represent will go through life more likely to leave school obese, according to the statistics, less likely to get the relevant immunisations, more likely to be admitted to hospital because of tooth decay or oral disease, more likely to get involved in drink and drugs and other issues as a teenager, more likely to rely on child and adolescent mental health services. So there is big health inequalities in society. So our job as a Labour Party and a Labour movement isn't just to rebuild the NHS, public, universal, free at the point of use for everybody. It's an all-out assault on these health inequalities. And that does begin with, yes, taking on the advertising industry over obesity and the advertising of junk food. It involves doing more to tackle issues around smoking and invest, and it means more to invest in children's dentistry. And it does mean reversing the disgraceful cuts to child and adolescent mental health services and investing in CAMHS and delivering a CAMHS worthy of the country. And they will say to you when you're campaigning, where is the money coming from? Well, say to them, this is a government that has cut billions in corporation tax cuts. It's a government that's cut $1 billion in inheritance tax cuts. Remind them that what stops this government from acting isn't the constraints of the economy, it's the ideological constraints of their dogma. And I tell you this, if 70 years ago, from the rubble, the carnage, the austerity of the 1940s, they could build a national health service, free at the point of use, covering every man, woman and child, then we owe it to their endeavour to show that we can do it again 70 years later. And that's what a Labour government with Jeremy Corbyn is going to do. Thank you.